favorite topics today relative to Hashimoto's because there's so much confusing stuff out there. And I've been in the Hashimoto's business since like literally you've even heard of Hashimoto's, probably before. And when we started out, when Hashimoto's, people would come in and they would come in here with fibromyalgia, chronic fatigue, these types of things, and then eventually would evaluate their thyroid and tell them that they had Hashimoto's as part of their clinical picture. And I go, no, my doctor told me that my lab tests were normal. Most of you have probably heard this by now. Why do I stop thyroid symptoms when my lab tests are normal? And the biggest reason back then was, there was twofold. One, nobody ran antibodies to find out that the person had Hashimoto's. And then once they ran them, there's mass confusion on what the range is for these antibodies should be. There's still semi-mass confusion on it. And so here's the recent data. So when we first started years ago, I think we already talked about the fact that to figure out whether you have Hashimoto's, you run these thyroid antibodies. And the one that we're going to talk about specifically, because it's the one that comes up positive most of the time, is the thyroid peroxidase antibodies, TPO antibodies. And when we first started running those antibodies years ago, the range was 0 to 100. So if you had to have antibodies more than 100. It'd have to be like 130, 105, something like that, for a doctor to say you have Hashimoto's. The problem was that a lot of people between the range of 9 and 100 had Hashimoto's symptoms, like all of them. Like 20 out of 20 symptoms they'd have, and then they'd test at 75 and they'd be told they're normal. But we worked on this for a long time towards this goal, and the vast majority of doctors were realizing that people who had these 20 symptoms or most of the symptoms, 10, 15, 16, 20 symptoms, they were in the ranges of 10 to, say, 100, and being told that they didn't have any Hashimoto's. Over a period of time, so the original functional medicine groups used the range of 0 to 9. We still use that range. And now, what's happening now is that different labs are coming around to those ranges. In fact, the Mayo Clinic now uses the range 0 to 9 for your thyroid antibodies. If you have it over 9, then they start considering that you have Hashimoto's. They say you have Hashimoto's. We have a big hospital here in Reno, renowned hospital. It's kind of gobbling up all of Reno, and they use the range 0 to 9. This has like been years in the making. Except we have another hospital here, St. Mary's, and they use 0 to 32. There are some labs that use 0 to 20. There are some doctors that will say, well, you're 12, which is outside of the range of 0 to 9, meaning you would have Hashimoto's. They go, well, we'll just wait and see if the antibodies get worse. And something that I've never been asked a question on, which is kind of interesting, is the antibody, how much do the antibodies even matter relative to how severe you are? And the answer is they don't. They just tell you that you have it. So if the antibodies are 300, it doesn't mean anything more than if they're 15. So those ranges and those numbers, as you can see, are quite confusing right now. Some doctors don't know what to do with them. Different labs use different numbers. I've seen labs where the range was 0 to 16. I've seen labs where the range is 0 to 20. Most of the labs I'm seeing are 0 to 32 still. We've treated people from a lot of different countries. So I think it's Belgium. The range is 0 to 5. There was another country that was 0 to 4. So it's confusing. We use 0 to 9. Our patients, I have fill out an assessment form before we treat them, and there's 2 whole sections on Hashimoto's and Hashimoto's thyroid disease. And if they fill out 20 out of 20 symptoms of Hashimoto's, and they're out of the range, they're in the range that says they're normal, we're probably going to treat them for Hashimoto's. Because one other nuance of the range, and you just asked about the range, but a nuance of this is you can be out of the range one day and be perfectly normal the next day. So relative to ranges, if you suspect you have Hashimoto's and you are tested normal, but you somehow know, you've gone on to Dr. Google and found out that you have all the symptoms of it, then you should run those antibodies a couple of weeks in a row. They're not expensive to run. And then see if they come up. If these antibodies come up positive for Hashimoto's, more than 0 to 9, more than 9 antibodies, once, if they come up positive even once, you have it. Even if it goes away, because some days the antibodies are up, some days you're in a good mood, some days you're calm, some days you're on vacation, and your antibodies go down. Other days you're normal and your antibodies are up, and so they'll measure. So that's kind of an important subject, and I wish I could give you more definitiveness on it relative to what your experiences might be, but the ultimate answer is the range that you should be looking at is 0 to 9. If you have antibodies that are over 9 at any given time, you should know that you have, for the thyroid peroxidase antibodies, you should know that you have Hashimoto's. There's another one, anti-thyroid globulin antibodies. They're lower. I've seen them 0 to 1 as range. I've seen the range 0 to 3. I've seen that all over the place. That one hardly ever comes up. And it's interesting, when it comes up, it usually comes up really high. So it's not really a question of whether it's 1 or 3. Usually it comes up like 30 or 300 or something like that. So that's thyroid antibody ranges. And those would be, you would be safe to use those ranges to figure out whether you actually now have an immune attack against your thyroid.